Hello, everyone. I'd like to begin by acknowledging that the land we are meeting on is traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. We also remind ourselves that wherever you are in this country, you are in land founded by a multitude of Indigenous peoples. These are interesting and exciting times as we move from reconciliation to what has often been called reconciliation. So welcome, everyone. Indeed, in speaking of Canada's Indigenous peoples, I was recently advised by a BC elder that many of their meetings begin with the invocation, "Greetings to all my relations," to demonstrate friendship and inclusion. And somehow at the start of this community meeting, I feel very comfortable in also offering that greeting to all of you, as well as in the spirit of our community. And thank you for making time for us today. It has been another year in the era of COVID, and while the future still remains somewhat unclear, I believe that the COVID experience has facilitated an opportunity for change at Kensington Health. Kicking us into the future, a catalyst for change, you pick the phrase, but these times have led us all to a place where working collaboratively has brought us much closer together, and in so doing has perhaps demonstrated the notion of finding good fortune in past and present adversity. Undaunted by all these adversities, the Kensington team has been forward-facing, and today we are delighted to share with you some elements of our continuing efforts to give new meaning to community healthcare. But before we hear from members of the Kensington team, let's first invite some comments from our guest speaker, Anna Greenberg, Chief Regional Officer, Toronto and East at Ontario Health. Anna has been a member of Ontario Health's senior leadership team since the organization's beginning. She has served as Chief of Strategy and Planning, leading the development of many strategic and corporate initiatives, and was instrumental in support of Ontario Health System's response to the COVID-19 pandemic. As Chief Regional Officer, Anna is directly responsible for the region's operational and system planning, supporting the healthcare system in implementing a pandemic response, advancing health system transformation, improving access to mental health and addiction services, and improving health equity across the region. Ladies and gentlemen, Anna Greenberg.
Thank you so much, Jim. I really appreciate the introduction, and it's really a pleasure to be here to be able to help kick off Kensington Health's annual community meeting. As Jim noted, I've been with Ontario Health since its inception, and I've been the Chief Regional Officer for Toronto and East since early September. And I know from all of my roles in being one of the legacy agencies that came together in Ontario Health, how important Kensington Health has been in advancing the goals of the Toronto region, and I know that that will continue. And when Jim talked about working collaboratively and being forward-facing as a theme, I think this is a great theme for continuing our partnership together. So I'm going to talk a little bit about Ontario Health and my role, about our shared priorities, and then to talk about how Kensington Health has really been a key partner in advancing these. So if we go to the next slide, Ontario Health has come together, 21 agencies have come together to form Ontario Health. The story of this is that in late 2019, through the Connecting Care Act, we merged 21 different organizations who previously had had different boards, different strategic plans, different leadership teams. And this includes the Cancer Care Ontario, the Provincial Cancer Agency, eHealth Ontario, which is the agency responsible for digital technology. And all of these came together under a single board, vision, and mission. And the result of this is that the province and the ministry now have one accountable organization and partner for broader health system transformation, performance management, transforming the delivery of healthcare, and also making care better for patients. And the health system and partners like Kensington Health now have one partner accountable at the provincial and the local level to enable transformation. And this not only reduces the administrative burden of organizations like Kensington Health, who would have been dealing, given your mandate, with many of these different partners as single entities and separate entities, now working as one, so that we can work on the project of enabling integration and enabling you to be a leader in the region. So if we go to the next slide, I represent that local part of Ontario Health. We're both a provincial organization, and also we take a very hyper-local approach to how we implement our shared priorities. So there are 5 Ontario Health regions. It's a bit faded in the map, but I'm coming to you speaking as the Chief Regional Officer for Toronto and East. And I have responsibility for engaging and involving partners like Kensington Health in planning for improvements in the system. And my team is always working to add value for better patient care. And this includes where new capacity in the system is most needed, trying to make it easier for patients to get the care that they need, enabling connections between health service providers so that moving from one type of care to another is as smooth as possible, and supporting new ways of working together so that patients and families wait less and get the care that they most need. So this is the work that we have together as regions, and I have 2 counterparts, a Chief Regional Officer in the North and a Chief Regional Officer in Central and West, and it's my privilege to work with organizations like yours in advancing this agenda. So if we go to the next slide, I mentioned that all of these 21 agencies that came together to form Ontario Health now have one set of priorities. And here they are on this slide. These represent where we think we can have the biggest impact for patients and families in Ontario and within our region. So the first is about being relentless, about identifying where there are inequities in the system and putting effort into reducing those gaps. And we saw this really starkly in the pandemic, where working with partners to offer testing and vaccination and supports for people living in shelters was a key way in which we tried to reduce inequities and growing disparities that we saw forming in the course of the pandemic. Transforming care with patient at the center is another way of saying that we're wrapping care and services around patients' needs. And these may be funded by health, they may be funded by long-term care, they may be funded by other ministries, and our job is to make that seamless for patients. And part of that is about making it possible for partners to work together on a regional approach or a sub-regional approach and not be competing for the same scarce resources, but working together as partners to say, where is this resource most needed on behalf of patients? Enhancing care and clinical care and service excellence. An unexpected example of this in the pandemic was that Ontario Health assumed responsibility for creating a provincial lab network that supported COVID testing. And within weeks, we had infrastructure to allow for a process for tens of thousands of tests to be performed today, where that provincial networked infrastructure had existed as multiple independent entities. And maximizing system value by applying evidence is a key priority. We're a clinical organization, and we have a job to rapidly synthesize evidence, new clinical evidence, analyze data, and set provincial standards to create the best possible quality and value for public investments. And that means we're setting standards provincially, and we're setting targets for where we want to be as a system, but then locally, there's a lot of work to say, how do we drive that evidence-based approach in a way that is suitable to the patients, communities, and populations we're trying to serve? And then finally, strengthening Ontario's ability to lead. This is about working together to make Ontario a leading health system across all of our clinical programs, no matter where care is delivered in the province. If we go to the next slide, every single health system right now in the world is turning its attention to recovery from the pandemic. Since the spring, we've been working with partners and on a plan for recovery, and really importantly, taking into account what worked well in the pandemic and trying to sustain that. That included new ways of working together, strong community leadership, rapid local solutions, and accounting for a lot of local flexibility to drive concrete outcomes. And we also acknowledge the need to transform many of the things that weren't working well before the pandemic, like not accepting inequities that we knew needed addressing. So the goals that you see here focused on preventative care and primary care, community mental health and addictions, access to care in the most appropriate setting, and really tackling the surgical backlog. All of these are trying to address a deficit in non-COVID care that was built up over the course of the pandemic. We go to the next slide. Everything that we do is in partnership. And I really want to highlight the many ways in which Kensington Health is working and leading to advance what are some very ambitious goals for our health system and for our region. And these are just a few examples of these that we've been working together with you on. So in health system recovery, Kensington has been pivotal in collaborating with the Toronto region on central waitlist management to increase access to surgery. In terms of transforming care with patient at the center, Kensington's been a community leader and partner in the development of the Midwest Toronto Ontario Health Team, the way we want to deliver care in the future. And delivering collaborative work through the OHT and taking on priorities in the pandemic, like testing and vaccination, like the YMCA mass immunization clinic. These have been absolutely vital, and they've demonstrated the need to work in partnership. And then reducing health inequities as the co-chair of Midwest Ontario Health Team's Health Equity and Community Relations Working Group, and as an early adopter of Toronto Region's anti-racism framework. And this is really concrete actions addressing racism through data collection, race-based and sociodemographic data, analysis and use of that data, and the importance of anti-racism training. So if we go to the last slide here, this is really depicting the Ontario Health Team and the future of where we want to see care build. So we're trying to build together a delivery system that's really from the patient's perspective, the resident, the client, the consumer's perspective of all of their care, including primary care, hospital services, mental health and addiction services, long-term care, and home and community care, all of that being seen by the patient and their family as coming from one team, a team that works seamlessly across all settings as patients move from different levels of care, as evidence affords. And we want to continue working together with innovative partners like Kensington Health to achieve that experience for patients and families, and really thinking about how do we not compete for resources, but how do we come together to plan the delivery system that we want to see for patients. So it's my pleasure to be able to be a part of your annual community meeting, and to, more importantly, to be an ongoing partner in your future and to work together in Toronto Region's goals. So thank you so much.
Okay, I think, oh, there we are, Jim. Hi.
I think I'm back.
You are back.
I think I'm back. So let me quickly jump in, John, and thank Anna. And Anna, thank you very much. All Canadians take their healthcare system very seriously. And the fact that you have put patient-centered care as almost the North Star is so important for all of us. And one of the items that I took away from you in its simplicity also almost acts as a North Star is the ability and your desire to simply make it easier for patients to get the health care they needed. So thank you very much, Anna. With that said, and just before we move to my friend John Yip, I'll just note that we'll be taking questions at the end of this presentation, as some of you may know. So please use the Q&A button on the bottom bar on the screen on the Zoom platform, should you have any questions for us. And even if we don't get to your question today, please know that we will respond as soon as we possibly can. So thank you for your questions, and thank you for your interest. So with that, I'll now turn it over to my friend and the CEO of Kensington Health, Mr. John Yip.
Thank you, Jim. Thank you. As board chair, you've been phenomenal to the organization. You have been a steady hand during this crisis, along with the rest of the Kensington Health Board of Directors, which I want to thank with gratitude, demonstrating community-based leadership throughout the past 12 months. And also a big thank you to Anna Greenberg. We hope to assist you and your team at Ontario Health through this journey to deliver care where care matters in the community. So we have a broad range of individuals logged in. So hello, everyone. We have residents from our long-term care home. We have their families, patients from our ambulatory side, clients from our community programs, our wonderful volunteers, our staff who are really the backbone of our organization, our leadership team who have stewarded this organization through a very turbulent time. They've been inspirational. So thank you to our leaders who are joined on this call, as well as our partners and colleagues from the ministries of long-term care, health, and of course, Ontario Health, and many, many more. So welcome to our annual community meeting. And throughout this hour, we will be sharing with you some of our experiences in the past year, but also where we would like to focus moving forward. So next slide, please. Just a quick overview of who we are. We are a community-based not-for-profit organization, and we have a history of doing two things really well. One is providing great care, day in, day out, throughout all the programs and services that we provide at Kensington Health. And the second thing being the ability to see around the corner, to see what's coming ahead. What are those unmet needs in the community? And hence our tagline of giving new meaning to community care. Next slide, please. In a nutshell, we've got two divisions. One is a community care division. We have a 350-bed long-term care home, as well as a hospice, a residential hospice, and we'll hear more about our plans there, as well as a 4-site community support services in the Second Mile Club. Next slide. We have a second division, which is focused on ambulatory care, the Kensington Eye Institute and the Kensington Vision Research Center, which is a center of excellence for ophthalmology care in Toronto. And supporting that is a provincial resource, our eye bank, which processes and distributes cornea tissue throughout the province and beyond. Our Kensington Screening Clinic that performs cancer screenings such as colonoscopy and endoscopies. And lastly, our diagnostic imaging center, which does diagnostic procedures, particularly around mammograms, x-rays, and ultrasounds, among other services. Next slide. And lastly, there are two key components that underpin what we do. And one is our research entity, the Kensington Research Institute, where we really want to promote intellectual curiosity in our clinician scientists. We have published over 30 manuscripts over the last 12 to 18 months, and also established a really good network of global clinical trials that are happening right at our doorstep. On the academic front, the education component, we are one of 5 non-hospital community-based organizations that have full affiliation with the University of Toronto Faculty of Medicine. But it doesn't stop there. We also have agreements with Faculty of Nursing and Social Work at U of T, but in addition to 12 plus other academic programs in universities and colleges. And so throughout our organizations, we have students running through the halls of Kensington and being an amazing support to what we do. Next slide. Our volunteers, really shepherd all of this. We have over 300 committed individuals who donate their time. I had the pleasure of meeting with the Volunteer Advisory Committee to talk about their role and our future, that we really rely on their support to shape who we are and what we do on a daily basis. Next slide. So as I mentioned, I want to spend this time walking through 5 areas of priority. And underpinning these 5 areas of focus, the title slide, which we kind of breezed by, the theme is you can't stop the waves, but you can learn to surf. And throughout the pandemic, we have been surfing, we have been trying to get ahead of the wave. And so these areas of focus really reflect the moving dynamic nature of water. So next slide, please. So long-term care, many of you know we have been challenged along with the 680 long-term care homes in the province, nationally and internationally. It's been tragic. We have wept, yet we've also learned and adapted. More importantly, we have persevered. We've worked together, the teams, the families, the residents, the volunteers, you're all tired. But we continue. And we continue because we have a sense of duty to care and a duty to our community. And so while we have faced moments of deep sorrow, of fear and exhaustion, there are silver linings. Next slide. And so instead of me talking about what those are, I want to showcase a video of Janet and Philip Simoni, who will talk about some of those silver linings over the last 12 months.
My name is Janet Simoni, and I'm married to Philip Simoni, who is a resident at Kensington Gardens. Philip was diagnosed in May of 2012 with Alzheimer's. There was a point where I realized that I would no longer be able to care for him. Kensington experienced the first wave last year. Nicoletta, who is the director of nursing, she called, and it is probably one of the worst calls that anyone could get, that their loved one has COVID. But she handled it in a very caring, calm, and professional way. What struck me was that I knew that in spite of the terror of knowing that my husband could die, I felt a sense of trust that he was in good care, and I knew that they were being proactive. It was a slow recovery, but God bless him, he fully recovered. Louise and her fiance, like many other couples of that year and this year, were prevented from having any kind of a large event. They had to cancel their wedding plans twice, but the one thing that was present in our mind, in our hearts, was that Philip had to be a part of this ceremony. So we approached Kensington, the administration, and they were very receptive. They said, oh yes, we have had weddings here, of course, but inside it was a perfect, picture-perfect day. I bought Phil a suit and had it altered, and he looked very handsome. He knew that this was happening. He was very excited. He was brought down, and I brought her in to the courtyard at the front, and we went up to Philip, and he said, you look so beautiful. So it was really a very poignant day, and Philip was part of it. There is a wonderful phrase, you can't stop the waves, but you can learn to surf. I think that Kensington Gardens has surfed enormously successfully thanks to the administration and their approach to all of this, their respect for our frontline workers, and this has resulted in individuals who have gone far beyond the call of duty, who have come in at risk, who have been exhausted, but have always had a smile on their face, show care and respect and love. I emphasize that love for the residents. And for that, thank you so much. Bravo.
Silver linings indeed. Thanks, Janet and Philip, for participating in the video. It gets me each time. And there are other silver linings here as shown in these wonderful photos taken by our communications team. It's been a long pandemic. It is ongoing. But as these images show, our teams, our staff have been phenomenal in the sense that they've adapted. We had Second Mile Club, community-based staff being redeployed on the floors. We've had corporate staff also been redeployed, and other of our program staff have supported our colleagues in the long-term care home. Yet this summer, we were really lucky to be able to have our annual staff barbecue, and it was great to have a safe, physically distant, masked event with an ice cream truck, which is our signature dessert at our barbecue. And it was just a wonderful event to celebrate the sacrifices, the hard work our staff have really provided us day in, day out. Next slide, please. So where are we going? We're still in a pandemic. It feels a little bit that we're in a lull, and if we use the wave analogy, but that's not to say we're out of it yet. We've been really successful in our vaccination campaign of staff and residents, and thank you for that. Our residents have had their third shots, and so we hope that all the protocols and procedures that have been put in place will continue to protect our residents, our families, and our staff. But we can't just rely on today. And so we do want to look ahead in a long range, 10-year horizon to really articulate what seniors care should look like. And so Bill O'Neill, who you'll hear from later, we've been talking about things that we want to do to improve the care of our seniors. And so the board and the management teams are starting to walk down this path to articulate what that is and how do we get there. We continue to advocate for the sector at the provincial level. Many of you know that Bill and I did meet with the Long-Term Care Commission, and we continue to advocate in areas that are meaningful to us, such as medical leadership in the home, in which we have fantastic leadership with Dr. Mark Goldstein and the physician team that should be mirrored right across the province. We'll talk a little bit more about equity, diversity, inclusion. We're very fortunate to have that attachment to our hospice to provide world-class palliative care and long-term care. And I really promote our relationship with Women's College Hospital throughout the pandemic and beyond through our partnered staffing that we continue to have on an ongoing basis as a result of what transpired during the pandemic. So we will try to get ahead of that wave post-pandemic. Next slide. So while we're getting ahead on the long-term care of the wave, there were moments where we felt like we were in the backwash of the wave on our ambulatory side. Here, we had to close all of our clinics due to the pandemic, restart, close again, restart. And so a little bit of an accordion, which really put a severe, significant pressure on our operating model. But as Anna mentioned at the top of this presentation, is we continue to see the opportunity to take a leadership position in the community by supporting our hospital colleagues to address surgical backlog. Next slide, please. And here, this is the magnitude of the problem, and an updated slide from September that shows the backlog is real, it's getting caught up, but the forecast is that it will take up to 2 to 3 years to get through the backlog. There's a limited amount of surgical capacity in our hospital system, and so we really advocated that the community can support that capacity outside of the hospital. Next slide. And to that end, where we're going is we have put in proposals to the ministry to expand our existing surgical capacity around cataracts and other surgical procedures. And we've taken advantage of the alternate health facility model to partner with hospitals to take on their surgical volume outside of the hospital and in the community. I'm pleased to say that we have 2 hospitals that have partnered with us. We're on the final brushstrokes of finalizing those agreements, but in a month's time, over 1,000 patients will receive their care at Kensington. Next slide, please. Anna mentioned the ongoing partnership with Ontario Health, particularly around the Ontario Health team, and Kensington has played a leadership role in the local delivery of health. And we have fortunately have the resources to be able to support the Secretariat to execute on those priorities. Next slide, please. And we have Justine Humphreys, our Senior Director of Strategy and Partnerships, to tell us all about that.
We have a pretty traditional definition of healthcare. Usually when you ask somebody what healthcare is, you know, I went to my family doctor, I took my kid to the emergency department with a broken arm and got a cast put on. My dad's in the hospital, you know, because he had a heart attack. But we're increasingly looking at healthcare differently. It's not just the medical model anymore. It's not just physical health. It also includes mental health and social health. And no one healthcare organization can really provide that full spectrum of physical, mental, and social health. What the Ontario Health team aims to do is stitch all that together, all those services together, through partnerships. And one of the key areas of partnership is with the community. The pandemic really demonstrated the power of the Ontario Health team because so much of the pandemic response relied on partnership. Whether it was our partnership with Women's College coming in to support the long-term care home, whether it was through testing across the Ontario Health team, our vaccine efforts across the Ontario Health team are staffed by staff from all sorts of different partners. So you could show up at a vaccine clinic and be working next to a social worker from a mental health and addictions organization and a medical director from a community health center. It's a true collaborative partnership to get this done. So much of the partnership relies on those special relationships with different communities to ensure that those that are most disproportionately impacted by the pandemic are supported through our efforts to get through this pandemic, and most notably through the vaccine initiatives.
Thanks, Justine. We have administered close to 22,000 vaccines in the local community to push forward this idea of trying to make healthcare barrier-free a reality. And it's a focus on the homeless population, seniors getting access to care, and also those individuals experiencing challenges with substance use. Those are our priorities, and we continue to advance those with our 60+ community-based partners in the Midwest Toronto area. Next slide, please. So the fourth area of focus for us is about learning how to surf. We are just at the onset of our journey here to dig deep around equity, diversity, and inclusion. We have seen tremendous social change in the last 12 months. We have seen the discovery of thousands of Indigenous children in residential schools. We have seen Black Lives Matter come to the forefront. We've experienced anti-Asian, anti-Islamophobic hate, yet we continue to move the social agenda forward here at Kensington Health to respect the wide, diverse workforce and people we serve here. And as Anna mentioned, we are not taking this lightly. This is not tokenism. We, in fact, have been working on this file for well over 25 years in our previous incarnation as Doctors Hospital, serving new Canadians, immigrants in the Kensington market area. We are just continuing and expanding the reach in this area. Next slide. So what are we doing? We are starting slow on these files, particularly around data collection, to understand what is the need. And from there, taking a very active approach around education and training, using different forms of communication, having dedicated resources, bringing in a health clinical equity lead and Dr. Nahid Dasani, so that we can take an equitable health approach throughout Kensington Health. Next slide. And so with this, I'm going to pass it over to Bill the Builder, who will talk about our fifth but important area of focus, our hospice expansion.
Thanks, John. I'll never live that name down. I think it's going to outlast me. Anyways, thanks so much for that introduction, and hello and welcome. I'm really excited to give you sort of a brief update on hospice construction. We're still targeting early 2022 for opening. Next slide, please. Big news, these pictures were just taken this week. As you can see, the windows going in, and you can see the potential garden on the left-hand side of the slide. And on the right-hand side, another picture of the potential gardens going in. Good news is the landscaping is going to be starting, I think, next week. So that's really good to see. And you can see, looking at the window, the beautiful, you see a concrete wall right now, but you will be seeing some beautiful flowers and plants on that. Next slide, please. Same type of thing. Next slide. I want to give you an overview of where we're at. There we go. Overview of the beautiful garden. And it's been a fairly complex build to begin with. We're still going through some growing pains, but we're getting there. I'd like to thank and support our partners in this project, IBI Construction, Garitano Brothers, and Colliers have been fantastic in helping us with the construction. Also, in anticipation for the opening, we've launched what we call an anticipation operations planning committee that will be looking at including all disciplines, is going to be helping us with the planning of where we go from here. It's going to be a whole new day for us. We will be the largest residential hospice in Canada, I believe. So we have to do it right. So we're doing a lot of pre-planning to make sure we get it right. I think that's my thing right now. Any questions will be taken later. I'm going to pass it over to Corinne, who's our wonderful CEO of our foundation. Oh, one more, the renderings. Thank you. You can see what it's going to look like. You saw the pictures of the construction was happening, but this is the end result. And you see those beautiful plants on the concrete wall. So we're really excited about it. Anyways, I'm going to pass it over to Corinne.
Hi there, I'm Corinne Restretz, and it's a pleasure to be here. So, next slide, thanks. I'm happy to talk to you a little bit about the foundation and what the foundation does. Next slide, please. So the Kensington Health Foundation is a really important partner to all the work that happens at Kensington. We provide ongoing financial support to the health center, and we're actually a really important part of community care. About $3.3 million is allocated by the foundation every year to Kensington's most urgent capital and operational needs, and that's about 6% of the total operating budget. And since 1998, we've actually paid out over $52 million in donations and grants, which is a very, very significant amount of money, and very much due to the good work of our foundation board and volunteer committees that oversee funds that we have. Next slide, please. So funds come to us in lots of different ways. In addition to obviously having assets and buildings, we do a lot of fundraising in order to support the good work of Kensington within the community. And this is just a snapshot of some of the programs that we run throughout the year. Many of you will be very, very familiar with them. Some of you will have been part of them. In fact, the last two videos that we just saw were part of our gala. We had a very special gala this year, again, not able to actually come together in person, but certainly doing so together virtually. We were able to raise about $224,000 with the support of our corporate partners, our community supporters, and many of you in the community. And Carolyn Taylor, who many of you might know from the Baroness von Sketch show, who's a longtime friend of Kensington Health, was actually our host and was just super fantastic. You may have seen some of our holiday campaigns that come out in the mail or via email. These are really, really important fundraisers for us and encourage people to get involved and to learn more about where funds go. And we have an exceptional host of volunteers and longtime supporters who support us through lots of different initiatives. So some of them are DIYs, like good old do-it-yourself, anything from a bake sale and a lemonade stand to things that are a little bit more sophisticated. So one of these examples, we had a wonderful volunteer-led fundraiser, was a partnership with Hooked Seafood Danforth, where beautiful lobster dinners were sold and all of the proceeds came to us. So it was delicious and fundraising. Partnership event that we did with Dior Canada, which saw luxury goodie bag come to people's homes, and then we did a virtual event. And also our annual Kensington Hike for Hospice, where some of our incredible supporters year over year, many of whom are families of former hospice residents, continue to support us and reach out to their own networks in order to raise really valuable funds and awareness. Next slide, please. So in terms of revenue and grant commitments, obviously we have a significant number of commitments that we make. We are there to ensure that funds will be there not just for Kensington now, but well into the future, and are custodians of those. And they come in lots of different ways. We receive donations through events and all of the charitable activities that we run. In addition to that, the foundation provides grants for both operations and for capital. And then we share services together. And so in the past year, which we run on a different year that ended June 30th, we were able to allocate over $3.1 million. Next slide, please. One of the most important things that the foundation does is that we work in partnership with Kensington Health to ensure that there's a really strong understanding of what we do in the community and engage those community members who actually can help to create impact on key projects. And there are many ways that people actually help to create a very, very significant impact through volunteering, giving of their time, and donations that actually help to change the course of the way we offer healthcare and certainly participate in Kensington's model of care. So I know that Bill just gave you a bit of a rundown on what the hospice expansion is looking like. But the hospice expansion really is an expansion in the fullest sense, metaphorically, physically, programmatically, and also an awareness in terms of raising awareness that we are expanding the way that people understand hospice and the need for hospice, especially now. So from a physical perspective, we will see, brand new facilities, expanded facilities, 9 new residential suites. There'll be state-of-the-art tech, garden space for quiet sort of contemplative moments, in addition to family gathering spaces, and an integration of our community day hospice program. Next slide, please. But in addition to that, one of the things that the hospice expansion does is it really lays bare the importance and the need for keeping end-of-life community care in the community where it belongs. And so hospice actually is a really significant supporter to the healthcare system. I know that sounds strange to think about it that way. But one of the things that hospice does in the community is it serves people at end of life in a caring and holistic way by offering comfort and care in the time when it's needed most. In addition to that, it also keeps space free in hospitals for really urgent needs. And, we now understand that in a way that perhaps 18 months or 2 years ago prior to the pandemic, we might not have understood in the same way. And the impact of that on the community is really important because first of all, it ensures that we have a team approach, and individuals who are facing end of life actually have the ability to go to a place that feels like home, that is where they get love and care. And at the same time, while they're getting the bespoke care that they need that meets their own particular health journey, we're keeping these hospital beds free for patients that require acute care. And that's really important. The other thing that hospice does that actually helps the healthcare system is it saves money, and it saves money for all of us because, as we know, just because something is government funded, it certainly doesn't mean that it's free. And hospice is one of those things that actually, while government provides some funding, the rest of the funding comes from the community, and a full 40% of funds actually come from philanthropy. But the cost of running hospice is better for the system because it's much cheaper to run hospice than it is to run hospital beds. Acute care is different. And so one of the important things that we're able to do is that when people are supporting Kensington Hospice, they're also able to support a system, they're able to support individuals and families at the most crucial time in their lives. And one of the ways, there's lots of ways that people can get involved in that. And we're often asked about, how can we participate? How can we learn more? What are the problems and how can we engage in this? And we're always looking for our cohort of supporters to become more engaged, to learn more about why hospice is so important, to learn more about the impact that it has on the healthcare system, and obviously to learn more about Kensington's model, which is exceptionally special and offers a level of care at truly the highest order. So if you would like to learn more about it, I would encourage you to visit the website. We actually have many more renderings, so Bill showed some, and to talk about why hospice is important, especially at this time, and understanding, so the different scope of needs and services that people have in the community. So the website is there up at the bottom. Thank you. And now next slide. Really thank you to all of you. We really could not do this without our community of supporters. And the thing about giving new meaning to community care is that you actually need to have a community that cares, which we do. And that's all of you. So from all of us at Kensington Health and at the Foundation, I want to thank you all for participating, for being there, for banging pots and pans, for supporting us, for bringing toques and meals, flowers, ice cream cones, standing on the streets and playing bagpipes. We've seen so many things during really, really difficult times. And sometimes challenging times bring out the heroes that are within. So thank you all for being heroes and sticking with us. And that's it for me. I'll turn it back over to you, Jim. Thanks.
Thanks, Corinne. And thank you to Anna, thank you to John, and thank you to Bill. A lot to take in there. One other comment I had was, or not, I didn't have, actually Jennifer had, and it said, just a heartfelt, very sincere thank you for your exceptional work. This is to everybody, folks. What a team. There I go. What a team. And so I'll pass that comment along to the frontline workers. So with that said, thank you all for your time. As we contemplate Kensington in these times of rapid transition, perhaps as Thomas Paine said years ago, the times have found us and has helped us all to continue to serve Kensington Health, and in so doing, give new meaning to the definition of community healthcare in the 21st century. On behalf of the Kensington Health Board, as well as John, Bill, Corinne, and the entire Kensington team, I offer our thanks to you for joining us today and best wishes to each and every one of you as members of the Kensington Health family. Thank you very much.